The MicroLoop and MicroLab spirometers are highly portable, allowing them to be used in physicians' offices for bedside testing. Both spirometers can be connected to micromedical spirometry PC software, which enables trending, reporting, and data sharing with your electronic health record, or EHR, and other PFT systems in the CareFusion family, including VMAX software. Both MicroLoop and MicroLab allow baseline and post-bronchodilator forced spirometry maneuvers to be performed, with a choice of predicted values, interpretive algorithms, quality assessment of each maneuver, or alternatively, configured to be fully NLHEP compliant. The MicroLab spirometer is equipped with a built-in printer. Thank you for choosing to watch this CareFusion Respiratory Diagnostics instruction video for the Micromedical MicroLoop and MicroLab spirometry products. This presentation will demonstrate the initial instrument setup as well as show you the preparations required to perform real measurements. As with most pulmonary function measurements, coaching a patient through the testing maneuver in the correct manner is vital, since it's one of the main factors influencing good quality data outcomes. Hence, in this e-training module, we'll show you how to correctly instruct the person performing the breathing maneuvers. Please choose a topic or press the arrow key to continue in the prescribed order. The MicroLab spirometer is supplied in a white cardboard box. The box also contains 2 multi-language manuals and power cable. The MicroLab spirometer and all necessary accessories are supplied in a hard shell carry case. Inside the case, you'll find the MicroLab spirometer, turbine transducer, power cable, main power supply, USB cable for PC and printer connection, a set of disposable one-way mouthpieces and nose clip. Before you start using the MicroLab spirometer, make sure it's fully charged. To charge the unit, plug the mains lead into the main socket and connect the power supply to the socket on the right-hand side of the unit. A red light will then indicate charging. To perform a test, take the turbine transducer out of the box and plug it into one of the 2 slots available at the side of the spirometer. When switching the unit on for the first time, the System Configuration menu will appear. To connect the MicroLab to your PC running the SPCS spirometry software, plug in the USB cable to the PC and the MicroLab. Tests can either be performed live, with results and graphs instantaneously displayed. Alternatively, stored results may be uploaded from the MicroLab to the PC software. The MicroLoop spirometer comes packed in a white cardboard box. The box also contains 2 multi-language manuals and power cable. The MicroLoop spirometer and all necessary accessories are supplied in a hard shell carry case. Inside the case you'll find the MicroLoop spirometer, turbine transducer, main power supply, power cable, USB cable for PC and printer connection, a set of disposable one-way mouthpieces, and a nose clip. Before you start using the MicroLoop spirometer, make sure it's fully charged. To charge the unit, start by placing it into the cradle supplied. Take the charger out of the carry case and plug it into the main socket. Connect the charger to the back of the cradle indicated by 5V2A. When you switch on the device, a running start bar will appear, and the red light on the top of the MicroLoop will light up to show the spirometer is charging. There are 2 buttons below the display on the MicroLab and MicroLoop. The button to the right turns the unit on and off. The button with the question mark can be pressed when the unit is on, and will activate textual help files for each screen being displayed at the time, as well as instructions as to how to navigate away from that screen to perform other functions. Prior to using your MicroLab or MicroLoop, it's strongly recommended that the unit is configured to your own personal or practice spirometry requirements, including the language, indices you wish to measure, and the measurement mode you wish to perform spirometry in. Using the stylus housed on the left-hand side of the unit, select Customize from the main menu and then select System. You can then choose the country settings for the unit. Selecting a country will automatically set the country-specific language, date format, height and weight units. These can be changed if required by touching the red arrow drop-down box and selecting an alternative choice from the default. Now select Next to continue. Select Customize from the drop-down menu. Select Spirometry and then select Next. The menu will then display the type of relaxed tests available: tidal, expiratory, or inspiratory. Selecting tidal will allow tidal breathing maneuvers to be performed prior to a VC measurement. Inspiratory or expiratory relaxed mode will allow a single breath maneuver to be performed without tidal breathing. On this screen, the flow units can be changed from liters per minute or liter per second for measuring peak flow. Select Next to continue. Touch the red drop-down box to choose from a range of predicted values. You can choose to test without displaying the FEV1-FVC ratio percentage of predicted, and for this purpose deactivate the indicator. You can choose if the predicted value marker should be displayed as an area on the flow volume and volume time graph or as a dotted line. Select Next to continue. The display default allows a choice of flow volume, volume time or animation to be selected. You are also offered the choice of selecting the incentive graphic you'd like displayed. During testing, the display can be changed by touching the red arrows in the top left and right-hand corners of the display to view an alternative graphic or the animation. The selection here, however, is the default, the preferred setting for testing patients. Now select Next to continue. The print option on this display allows you to choose which graphs from the spirometry maneuver you'd like printed: both, only flow volume, only volume time, or neither. Also, the option to print the relaxed tidal vital capacity can be chosen here. Now select Next to continue. The option on this screen allows selection of the best blow criteria and the quality criteria applied to the blows for reproducibility between maneuvers. The current ATS ERS 2005 standards recommend the individual best criteria are used. Quality criteria are based on national preferences and can be chosen from the BTS, the British Thoracic Society, or ATS, American Thoracic Society. The acceptable inhale-exhale criteria allow a chosen ratio, for example 50 to be selected, which enables a separate inspiratory maneuver to be performed when a patient is unable to fully inhale after exhalation. Leaving the value at 0 means no criteria has been set and the maneuver can't be performed separately from an expiratory maneuver. Select Next to proceed. A choice of automatic interpretations is available. Do note that these are based on published algorithms and should be used just as a guide. Interpretation of spirometry results should always be performed by qualified healthcare professionals. Calculation of lung age can be turned on or off using the drop-down menu. Calculation here is based on the patient's FEV1 percentage of predicted and can often serve as a good motivational tool for smokers to consider quitting when they see their FEV1 percentage of predicted has declined and their estimated lung age has increased. Select Next to continue. The dyspnea and smoking status can both be turned on or off. If smoking status is turned on, then the option to enter the patient's daily cigarette consumption is available. What you select will determine whether these are required when entering the patient's demographics. Now select Next to continue. Both the Microlab and MicroLoop use the CareFusion digital volume turbine transducer. The turbine is extremely stable and is unaffected by external influences such as altitude, temperature, or humidity. Recalibration by the user isn't recommended. However, we do recommend verification or a calibration check in keeping with the current ATS ERS 2005 guidelines on a daily basis, using a 3-litre syringe, CareFusion part number 36 SM2125. The calibration reminder can be set to off or daily to prompt the user to perform the calibration check prior to using the device. The temperature adjustment can be displayed if required and altered by the user. The ambient temperature is automatically measured and used in the ATPS to BTPS calculations, irrespective of whether it's displayed or not. Now select Next to continue. The indices to be displayed can be selected from the list shown for both forced and relaxed maneuvers. All indices are measured and recorded on the spirometer. However, only those selected on these screen menus will be displayed and printed together with the test results. Further indices can be added to the test by going back and selecting them if the test has been saved. To proceed through the list, select Next. Once you've made your selection, press Finish to return to the main menu. Prior to performing spirometry tests, patients should be advised in advance to avoid certain activities to ensure optimal test results. Prior to attending a spirometry test, the patient should be advised not to smoke within at least 1 hour of the test, not to consume alcohol within 4 hours of testing, not engage in vigorous exercise within 30 minutes of testing, nor eat a large meal within 2 hours before the test. The current ATS ERS 2005 guidelines give the following advice on contraindications for performing spirometry. Patients should not be tested within 1 month of myocardial infarction. Suboptimal spirometry results are likely in individuals suffering from chest or abdominal pain, oral or facial pain exacerbated by a mouthpiece, stress incontinence, dementia, or individuals in a state of confusion. If you need to enter a patient's details or recall a patient from the spirometer database, please ensure his or her demographic details are correct prior to commencing testing. The patient should be in a relaxed state. Note the patient's medication and make sure that any tight items of clothing are loosened or removed. We recommend using a MicroGuard filter for each patient tested and then disposing of it after the test. MicroGuard filters have a 99.99% bacterial and viral efficacy and should be used as part of spirometry hygiene and cross-contamination procedures. MicroGuard filters can be connected directly to the turbine. Alternatively, if a disposable cardboard mouthpiece is used, the adapter supplied with the Micro 1 should be wiped with a disinfection cloth after each patient test. CareFusion can supply filters with a round mouthpiece or an oval one with teeth marks. Filters can be supplied on their own or with a nose clip in a single patient-use disposable set. Prior to performing a test, we recommend that the patient's details are entered into the spirometer for storage in the database. Use the stylus and on-screen keyboard to do this. It's important to ensure that the correct name, ID, and demographic details are entered for the patient being tested. These details will also be used to calculate the applicable reference values. When you've done this, select Finish. The main menu will be displayed, and you'll find the patient's name or ID at the bottom of the display in the grey bar. Select the test to be performed by touching the appropriate icon on the screen. If the patient's details already exist in the database, then a search can be performed by typing in the person's ID or name. Alternatively, you can touch the ID or name heading to list the database in order and scroll through until you find the person you're looking for. Using the stylus, select the patient and then select OK to return to the main menu to perform a test. The main menu will be displayed and you'll find the patient's name or ID at the bottom of the display in the grey bar. Using the stylus, select the test type to be performed, either relaxed spirometry, forced spirometry or maximum voluntary ventilation. If tidal breathing isn't required, then instruct the patient to inhale fully to total lung capacity and then exhale at a sustained and comfortable speed to measure expiratory vital capacity, or exhale fully to residual volume and then inhale fully to measure inspiratory vital capacity. The display will show a volume time graph as well as a volume bar of the maneuver. Vital capacity with tidal breathing. Now ask the patient to start tidally breathing with normal breaths and then perform a maximal inhalation and maximal exhalation. Both maneuvers should be performed at a sustained and comfortable speed. To repeat the test, select Again. When the test has been completed, select Done. Now let's demonstrate in detail how the patient needs to be instructed using the tidal breathing vital capacity maneuver. Ask the patient to breathe normally. 3 tidal breaths should be recorded. At the next breath, instruct the patient to take a deep breath. A line will appear on the spirometer display and an audible beep will be emitted. Repeat the maneuver to collect multiple reproducible measurements. In, more now, and then breathe out. More. Empty your lungs completely. Well done. This video shows a forced spirometry maneuver without tidal breathing. With the patient seated, ask him or her to place a nose clip on the nose and the MicroGuard filter or mouthpiece into the mouth. Make sure the teeth are firmly positioned on the housing and the lips form a tight seal. The blue area denoted is the patient's predicted area. Now ask the patient to take a maximum expiration and to take a maximum inspiration. And now let's show you what can be achieved by providing the greatest possible encouragement to the patient. Ask the patient to take a maximum inspiration and blast the air out.
So when you're ready, big breath in. Blow hard. Keep going, don't stop. Keep going more. Big breath in. Good. You can come off the mouthpiece, relax.
You can see that the expiration is slightly to the right and there isn't a particularly sharp point at the top of the expiration. Now let's give the patient more encouragement this time and see how it affects the graph.
Don't stop. Keep going. Now big breath in. Perfect. Good job.
You can see that the line of expiration shifted to the left axis and the point is much higher, showing a larger and faster peak flow. Ideally, we want 3 good maneuvers.
When you're ready, deep breath in, blow hard. Keep going, good. Blow. Big breath in. Okay.
You can see now the display is showing good blow. This video shows a forced spirometry with tidal breathing. For tidal breathing, ask the patient to perform tidal breaths. It's in and out, in and out. In, then ask him or her to inhale and then blast the air out as hard and as fast as possible, and then inhale fully again.
Very good. Relax.
We want to obtain 3 technically satisfactory maneuvers. Again, encouragement should be given. Tidal breathing.
Put the mouthpiece in the mouth, lips closed.
In, out. In, out. In, out.
Big breath in. Blow hard. Don't stop. Keep going, keep going, keep going, keep going. And then big breath in. And come off the mouthpiece, breathe normal.
You can see that with encouragement, the variation is only 1%. Now we need to repeat the process a third time. Again, tidal breaths, in and out, in and out, in.
Now big breath in. Blow hard. Good, don't stop. Keep going a little bit more. Keep going, keep going, keep going. Big breath in. Very good.
The display will show you've met the quality criteria for reproducibility. To start a post-test, select the patient's icon from the main menu, then select or search for your patient, and then click View. Patient details will then appear in the upper section of the screen, and the date when each examination and base or post-test was performed will appear in the lower section. Select the latest examination and click Post 1 to start a post-test for this examination. In the Spirometry main menu, select the type of post-test you want and then perform it. The results of all blows contained can be viewed once the post-test has been completed. Here you can compare the results of blows before and after medication. Touch the numbered boxes to select a blow. Each blow can be viewed as values or graphs. A plus sign in a box indicates the best individual result. You may have chosen best blow criteria during customization individually, for example, FEV 1% of predicted. Then the best blow based on this criteria will be highlighted with an asterisk. Click Done when you've finished, and don't forget to save the results of current tests before you exit. To perform a maximum voluntary ventilation test from the main menu, we select the MVV maneuver. With the patient seated, ask him or her to place a nose clip on the nose and the MicroGuard filter or mouthpiece into the mouth. Make sure the teeth are firmly positioned on the housing and the lips form a tight seal. Now ask the patient to tidally breathe out for at least 3 breaths and then start heavy, rapid tidal breathing when prompted on the screen and when they hear a beep.
Good. You've got 5 seconds. 5 more. Good. Keep going.
The display will show a green line to indicate that the 12-second test has been completed. The maximum voluntary ventilation in liters per minute will be displayed along with the breath rate, shown in red or green, depending on whether the test maneuver was acceptable. Press again to repeat the test. The test can be stopped once the ATS-ERS reproducibility criterion has been met. The current ATS-ERS guidelines recommend that spirometry calibration checks are performed on a daily basis, using a 3-litre syringe. It's important that records are kept of calibration checks performed on the spirometer, including the date, spirometer serial number, and the pass value. Connect the syringe adapter to the syringe and connect the spirometer transducer as shown in the picture. Touch the calibration check icon on the main screen of the spirometer. Select the spirometry icon and then select Check Calibration. The calibration check should be performed at 3 flow rates. The display will show 2 grey bands. These are for guidance as to the speed the syringe should be emptied and filled. When emptying and filling the syringe, the maneuver should be performed at a smooth, sustained speed, avoiding slowing or stopping during the maneuver. As per the instructions on the screen, empty the syringe by pushing the plunger in and then fill the syringe by pulling the plunger back out. The process can be repeated if necessary by rejecting the current maneuver and repeating. Once the maneuver has been completed, select Next to move to the next flow rate, where the grey bands will guide you as to the speed the syringe should be emptied and filled. When all 3 flow rates have been performed, the display will show a report of the inspiratory and expiratory flow rates for each calibration band with a pass or fail status. The spirometer should pass on each flow rate. Should calibration fail, then repeat the maneuver, checking that the syringe shaft is moving freely and that there are no leakage paths. If calibration continues to fail, then clean the turbine as per the instruction manual and then repeat the calibration check. Thank you for watching this presentation. As you'll have noticed, good quality results very much depend on coaching patients to perform the maneuver correctly. The American Thoracic Society and the European Respiratory Society have clear guidelines on how to perform spirometry testing. It's recommended that operators are thoroughly familiar with these guidelines, but do note that local guidelines may also apply. We recommend that you use only CareFusion accessories with a Microlab or MicroLoop spirometer. For advice on accessories or any technical support questions, just contact our dedicated support team or visit our website.